Today we're going to talk about dyslexia. What is dyslexia? Dyslexia is a learning disorder that involves difficulty reading, identifying speech sounds, and learning how they relate to letters and words. Many students struggle with dyslexia, and it causes an extreme problem if it's not dealt with and the child allowed to continue to grow and continue to learn. How is a child diagnosed with dyslexia? Well, your child's development, educational issues, and medical histories are some of the first things that are looked at. Their home life is taken into account to decide whether or not some of the problems may be home-related. Questionnaires may have to be filled out asking various questions about the student and about the student's learning conditions. Vision, hearing, and brain tests are also sometimes necessary to decide whether the problem may be with something other than a learning disability. Psychological testing may also be required. Testing in reading and other academic skills will also play a major role in diagnosing whether or not your child has dyslexia. It's often a teacher or parent that first calls into question whether or not a student may have dyslexia. So what can parents do if their child is diagnosed with dyslexia? Well, there's a number of things that parents can do. They can help their child with repetition and review of skills. There's not enough time in the day at school for students who struggle with dyslexia to have the repetition and review that they need, and the parents can help out at home. Also, at home, they can have individual instruction by their parents. Parents can help teach decoding skills. Parents can help by drilling sight words. Probably the most important thing that parents can do involve providing emotional support for a child who is struggling and may not understand why. The child may not understand what's going on with them, and the parent can provide the necessary emotional support for the student. And the parent needs to work with the schools. They need to work with the teachers and the special resources that the school has access to in order to ensure that their child with dyslexia gets all of the benefits and gets all of the educational experiences that they need. What can schools do? Schools need to provide adequate accommodations. This might include providing alternate teaching methods. It might also include providing alternate teaching materials. It also involves providing education for parents. Many people are unaware of what dyslexia is, and this in education is a problem for students because students are already struggling. Their parents need to be provided with education as to why they're struggling, and parents need to understand that dyslexia is more common than people realize, and it says nothing negative about the student, and it's not anything that the student can control. So can students with dyslexia be successful? Yes. Dyslexia does not mean incapable. Dyslexia just adds an extra layer of difficulty to a student, but students can be extremely smart and struggle with dyslexia. Dyslexic students can succeed like anyone else, just at times they are required to have a little additional help. They're required to have some additional people that will pour into their lives, and they're required to have some additional learning opportunities. Thank you to the Mayo Clinic, to the Child Mind Institute for the resources that they provided, as well as readingrockets.org.